Hi, my name is Corey Anderson, and I'm going to be talking to you about healthcare quality today. Well, I can tell you a little bit of my experience with the socialized medical system. It comes with a pretty extreme background story. Started about 8 years ago. I went out with some girlfriends for a birthday party, and at this time, we went to dinner. We were going to a club. We were going to go dancing, and I remember getting in the club, and I remember having my first drink at the bar, but everything goes black after that. Next thing that happened is I woke up and I was in a hospital bed, and one of my best friends was crying over me. She told me that I was in a car accident, and the worst part about it was I was the one that had been driving. It seems that when they tested my blood, something had gotten slipped in the very first drink that I had. Well, my face had hit the steering wheel, and I had multiple broken bones in my face. They included an orbital rim fracture and a shattered jaw. I was been taken to an academic medical center, or a teaching hospital, as they called it, which I'm told is where they take people who don't have insurance. Well, had anyone taken the time to open my wallet or to care, they would have seen an insurance card at the front of the wallet. They also would have seen a driver's license with my name on it. But at least one of the paramedics did take the time to answer my cell phone because my friend was able to find me and to let them know I wasn't a Jane Doe. Not long after being admitted, I was transferred from the ICU into the general ward due to gunshot victims needing to be brought into the ICU. I do live in New Orleans, after all. Unfortunately, I couldn't leave the hospital because my orbital rim was completely fractured and they had to repair it. If they didn't repair it, then my vision would be damaged permanently for my entire life. I had to have surgery. So, because it is a teaching hospital, you do have to wait around a little bit. Every morning at 5:30, a nurse came and she got me out of bed, put me in a wheelchair, and she would wheel me down to this big waiting room, just full of people. And I would wait there until noon and just hope that they would call my number. Well, after 5 days, they never did. My parents, of course, got fed up with the entire situation and didn't really want to wait anymore and chose instead to take me to a much more expensive surgeon. But he was actually able to repair my jaw and my eye socket in just one surgery. I have titanium plates and it's held everything together all right. The difference between this new surgeon who was fully qualified to work on me and this teaching hospital was night and day. I wasn't just a number, I had a name. I was a person. But I'm never going to forget my final thoughts on my experience in that hospital. What if I actually hadn't have had insurance? What would I have done? What kind of care would I have received after surgery? The experience opened my eyes to the state of healthcare, and that was before the Affordable Care Act was even enacted. Since then, the quality of patient care ratings have only gone down. About 50 years ago, it all started to this major overhaul in healthcare reform. It began because doctors were getting all kinds of malpractice lawsuits filed against them. Although it can be looked at as being blamed on the malpractice lawyers for just filing frivolous lawsuits, not all of them were. These doctors, instead of dealing with their damaged reputations and their negative rumors, they chose to often relocate. And when they did, they didn't disclose any of the negativity to their new patients. This caused a huge detriment to patient safety and security. Congress finally had enough. In 1986, they enacted the Healthcare Quality Improvement Act, which was to protect both doctors and patients. It also allowed the Health and Human Services Department to create a full database. This database would record career histories of medical professionals. That way they couldn't run away, just to avoid the negativity. About 30 years later, the Robert Wood Johnson Foundation chose a few areas that they thought that they could initiate a transformation on the full healthcare system. They chose some communities and they got cooperation from healthcare providers and healthcare professionals in that area. They set 5 goals. Their 5 goals were they were going to enhance the quality while reducing costs, performance measurement and reporting, quality improvement, engaging customers in their health and healthcare, and reducing healthcare disparities, reforming payments. The goal of their transformation venture was to raise quality, equality, and the value of healthcare for everyone. Although it was a 10-year project, which ultimately was inconclusive on the larger scale, they did realize that what worked in some communities didn't work in others. So the project was completed in 2015. The Robert Wood Foundation partnered with the Lown Institute to create an awareness week for educational awareness for healthcare professionals and patients to increase awareness about treatment overuse, treatment underuse, and the receipt of inappropriate health care. The goal was to encourage education to patients about medical care, specifically the overuse, the underuse, and especially the inappropriate care. Their wishful thinking in this process was that they were going to raise awareness to patients and stop the excessive issues within the system. So patients would have the knowledge to ask questions before just blindly accepting whatever a doctor told them. It was then thought that healthcare professionals would obligatorily provide the most compassionate and appropriate care to every single patient in the future. It's all a pipe dream though, right? In the fall of 2015, 2 years after the Affordable Care Act was implemented, National NPR conducted a poll to gauge the general population's thoughts on the Affordable Care Act. And they used a sample of individuals of varying socioeconomic statuses to sample this. Over half, a full 61%, felt that the nation's healthcare as a whole was fair or poor. 1 in 5 adults in the last 2 years had been unable to receive healthcare that they required. Even worse, a lot of them couldn't even see their regular doctors anymore. Worst of all, people who identified as low income felt that the quality of care that they had received was poor. In closing, healthcare, and most importantly, quality of patient care, shouldn't be a categorical issue. Patients come in all different shapes, sizes, attitudes, needs, socioeconomic statuses. The Department of Health and Human Services has 6 aims that they use as measurements for healthcare quality. Those are safety, effectiveness, patient-centeredness, timely care, efficiency, and equitability. Reforming the nation's healthcare system is one of the top legislations facing Congress today. There are so many bills floating around though. So much is being presented. Unfortunately, as with the Affordable Care Act, a lot of things are being unreasonably added into legislation that would actually diminish the quality of healthcare for a lot of people. But I'm doing my best not to look at this with negativity. We gotta hope that our elected officials have our best interests at heart and that none of us will simply become a number in a waiting room.